Totally. And I think, that actually leads me on really nicely to my next question. Because I know that there will be people watching this who are facing that very challenge right now in their business. And actually, I've done a couple of spotlights around the area of the menopause, and I know it is something that a lot of business owners are really interested to hear more about and to kind of, tackle in a positive way, and quite rightly so. So my next question is around, what can you actually do to overcome these challenges? So what can these employers do to make sure that they are seen as employers of choice and that they are positive about their workforce that potentially are going through situations like the menopause that does come with a more aging workforce?
Yeah, and I think clearly there's not going to be a kind of overnight solution.
Yeah,
Culture is going to take time to change. And for me, the key thing is awareness. So
yeah,
trying to create an environment that is safe for people to talk about these things, not feel they're going to be penalised or frowned upon. And that's definitely going to develop over time into a workplace that's open and transparent on talking about the menopause. So I suppose thinking about what we've been advising clients and on similar issues is first of all consideration of implementing a menopause policy.
yeah,
Now, what does that really mean?
yeah,
Well, for me would be something that's targeted towards your managers and in your employees. So you have both sides are having the benefit of this document. I think probably explaining what the symptoms are and not always the typical symptoms, because
yeah,
there's probably a bit of a stereotype around the main symptoms that people know about, but there's
yeah.
lots others out there that aren't necessarily ones that people are aware of.
Yeah, and
Um,
actually, sorry to interrupt, but I'm just,
yeah,
conscious actually that I've said, the menopause is a typical challenge that comes with an aging workforce. But let's not forget that there are lots of women that go through early menopause, so it's something that they
yeah.
should be aware of anyway.
Exactly. And that's exactly what I was going to say there was is demystifying that age bracket,
Yeah,
because typically it's between the age of 45 and 55, but there are lots of women who experience it much earlier than that.
yeah,
So it's demystifying that age bracket around it, that there is no set age at which you will
hmm,
undergo the menopause. And I suppose there's also the perimenopause as well, which comes with in advance of developing and going through the menopause. So I think that the policy would set out these types of issues, trying to make these out
yes,
clear, giving an understanding, what the employee could do and who they can go and speak to if they feel like they're struggling at work or they're having these symptoms that's impacting on their job. Obviously, signposting them to things like occupational health and employee
yeah,
assistance programs if you have those. And then I think, as well as that, advising managers to think about risk assessments for people who
yeah,
are specifically going through the menopause, and also abilities for employees and managers to consider alterations to their duties or workplace adaptations. And I think I'll talk a little bit more about them shortly, but those are the types of things I think your policy should cover as a minimum.
okay,
Um, Secondly, I suppose just generally an awareness piece that you have the menopause within your equality, diversity, and inclusion training,
yeah,
making sure it's really firmly on the radar, you're raising awareness about it, how people could fall into harassing or discriminatory comments by saying certain things to people who are
of
undergoing
course,
the
yeah,
menopause,
yeah,
and making them aware of that. Um, Training your managers, so as well as having your policy, having really tailored, interactive, specific training on how to manage them, how to deal with any sickness absence that might arise or
okay,
capability issues. And again, I think flexible working requests, there isn't really anything to stop an employer from allowing any employee to make a request to
absolutely,
alter, their
yeah,
working hours and or their working pattern, and thinking about why that would be helpful to broaden that out to this category. Um, so I think, yeah, providing adjustments as well would be something that we want to think about as an employer. As I mentioned, we'd have that in the policy section. So thinking about the environment, is there comfortable toilets,
yes,
cold water,
yeah,
temperature control, if they
okay,
got a menopause friendly uniform, depending on the work environment, is
yeah,
it comfortable to work in?
yeah,
Um, And maybe even having a kind of a support or mentor or buddy to help them through that period, someone else who's maybe gone through something similar.
Mm-hmm.
And we've also got some of our clients specifically, they have menopause cafes or menopause
Yeah,
support
I've heard
group.
of this actually.
Yeah.
Yeah, yes.
So a kind of a place, a safe space to have a discussion in a group about what people are experiencing, the different impacts, how they've overcome those challenges, and perhaps having a kind of internal menopause champion, like some organizations have mental
Yeah,
health champions. And maybe even having an external speaker in to talk about the symptoms, somebody from a medical background that
yes,
can provide a bit of comfort and normalize the issues, make people
definitely.
feel like they're not
Yeah,
the only ones sitting
absolutely.
with these
Yeah,
conditions, with these symptoms. And just, I suppose these are all things to try and make people feel more comfortable and to try and speak about these issues, so that we can support them, I suppose,
yeah,
as an employer, ultimately.
totally. And I think you make a really valid point actually about, particularly when you're talking about, having menopause champions and having kind of safe places, menopause cafes. Everybody's journey and experience with the menopause is very different. It's not standardized as such. You are going to have variances in it. So to have that ability to feel safe in talking about it and sharing your experience can only be a good thing. And obviously, as an employer, if you put yourself in a place where your employees feel comfortable to do that, then surely that is a really positive step.
Yeah, absolutely. I think that's key to it. People are potentially worried about, oh, I'm the only one that's undergoing this,
Yeah,
or I've not heard of this as a typical menopause symptom before. But it's trying to make talking about it normal and acceptable,
exactly.
encourage it, and then we can identify, well, this is what we can do to try and support you,
Absolutely.
as
Absolutely.
a business. And I think it's on employees as well to be willing and able to talk about these things to then get the support in return.
Totally.
Yeah.
Jemma, I cannot thank you enough. I know that a lot of people that will be watching this will completely resonate with what you're saying, both actually women going through this and maybe in organizations that they just feel there's not that support there. So they'll be able to go to their leaders and say, look, just seen this podcast and I really want to sort of try and make some suggestions. But equally, for all those kind of business leaders out there who are doing the best job that they can, but could be doing more, this will give them some great insights to that. So thank you so much for joining me. What I will do is I will tag your details in the post so that if anybody who's watching maybe wants to pick your brain further, which I'm sure they will, they can just reach out to you directly. But Jemma, certainly thank you again for joining me on today's Spotlight.
Thank you, Katie. Thanks for having me.